Hello, my name is John Brisson, author of Fix Your Gut and Health Coach. Welcome to the Fix Your Gut YouTube channel. Today we're going to talk about the tricyclic antidepressant amitriptyline, also known as its trade name Elavil, and it's used for reflux disorders as well as chronic functional abdominal pain. And why here at Fix Your Gut we do not recommend the use of the medication if all possible. So amitriptyline is a tricyclic antidepressant. Tricyclic meaning the chemical structure contains three rings that are fused with a side chain. That was discovered in the early 60s and was approved by the United States Food and Drug Administration in 1961. In 2016, it was the 88th most prescribed drug medication in the United States with more than 8 million prescriptions. It is a potent serotonin reuptake inhibitor, a moderate norepinephrine reuptake inhibitor, and does not strongly affect dopamine reuptake within the brain. A reuptake inhibitor is anything that reduces the body's ability to reuptake neurotransmitters, including the amount of neurotransmitters that are within the synaptic cleft, which is a space between the neurons within the brain. And during reuptake, a transporter protein takes excess neurotransmitter molecules out of the synaptic cleft or puts them back into the neuron. So these medications inhibit that so that you have more of certain neurotransmitters that are left in between the synaptic cleft, so they're more bioavailable. The medication is also a histamine antagonist, H1 and H2. So since it is an H2 antagonist, it would reduce stomach acid production, as well as it does blocks histamine's effect on the brain. Histamine is an alert neurotransmitter, meaning that when you have histamine in the brain, which is normal, everybody has a certain amount of histamine within their brain, that it triggers alertness, where antihistamines like Benadryl, when it reduces the body's reaction of histamine to your cells and to your neurons, it'll make you very sleepy. So it's the same with amitriptyline, which is one of the reasons why it's used for sleep, is because it is a histamine antagonist. It also is an NMDA antagonist. It decreases substance P and activates adenosine A1 and opioid receptors, and all of those together reduces pain. And finally, amitriptyline inhibits sodium channels and calcium channels, as well as potassium channels within the heart, and therefore that is why it is known to cause numerous cardiovascular side effects, which we will talk about later. According to the amitriptyline or Elavil medication insert, amitriptyline, there is its actual mechanism of action is not known. Even though it's been around since the 1960s, it's a complete mechanism of action of how it raises or these neurotransmitters or blocks other ones. Its complete action within the brain is unknown completely. Amitriptyline is further metabolized in the liver by CYP2D6 and CYP2C19 enzymes, and there are certain genes that a person will have that would encode these enzymes. So if you have polymorphisms or mutations in these genes, you may require a lower dose of amitriptyline. If you have multiple copies of this gene, or of those genes, you're able to produce more of those enzymes, which means that you would have to take more of the amitriptyline for it to get a therapeutic effect. Nortriptyline is what amitriptyline is metabolized in the liver by these enzymes, and it's actually a more potent and selective norepinephrine reuptake inhibitor than amitriptyline is. So it actually will cause more of higher increase of norepinephrine, which is another alert neurotransmitter within the brain, concentrations of it within the synaptic cleft, than just amitriptyline in and of itself. Amitriptyline also interacts with many other different medications, but I won't go through all that list. It's in my blog, linked down in the show notes below. So amitriptyline is used for the following medical conditions: anxiety, bipolar disorder, cyclic vomiting syndrome, eating disorders, depression, fibromyalgia, insomnia, irritable bowel syndrome, someone has diarrhea, major depression disorder, migraines, neurogenic cough, nocturnal urenesis, which is bedwetting, pain, Parkinson's disease, psychosis, post-traumatic stress disorder, schizophrenia, sphincter of odd dysfunction, tension headaches, visceral hypersensitivity, and vagal neuropathy. Amitriptyline is used for digestive issues in people with reflux, visceral hypersensitivity, neurogenic cough, which is seen as silent reflux, to improve vagal nerve tone, to help with esophageal motility, globulus pharyngeus, which is pharyngitis, which is like a pharyngitis, which is a lump in the throat. It's usually amitriptyline is used off-label for all of those digestive health conditions. The actual approved label use within the medication insert is only for to relieve symptoms of depression. All other uses of the medication are considered off-label uses. Now, amitriptyline has many side effects, many adverse reactions. I posted pictures of the drug insert of the adverse reactions part of it for amitriptyline in the blog, which I'll link down in the show notes. I won't go over them; it's very long. Some of the listed side effects, we'll go over a few quick of them. Dry mouth, drowsiness, weight gain, sexual dysfunction, arrhythmia, elevated blood pressure, constipation, worsening reflux in some cases, because even though, we'll talk about it later, it dulls the pain within reflux disorders, it actually weakens the sphincters, the upper esophageal and lower esophageal sphincter, because amitriptyline is a smooth muscle relaxer. Amitriptyline and Elavil also depletes CoQ10, so if you're taking the medication, it's probably best that you ask your doctor about supplementing with ubiquinol during it, because it does deplete CoQ10, which can lead to mitochondrial issues. In addition, it's been linked to suicide and increased depression. And the use of amitriptyline is cautioned within the drugs insert. It's used in children, adolescents, and young adults, and is not approved in pediatric patients. Actually, according to the medication insert, if you're under the age of 18, there is 14 additional suicides per 1,000 people taking amitriptyline, which is a pretty significant number. Meaning if you had 1 million people taking amitriptyline, that would be 14,000 suicides associated with its use. Ages 18 to 24, it's 5 additional cases of suicide. The ages between 25 and 64, it's only 1 fewer case, meaning people who took placebo per 1,000 people had 1 fewer case of suicide. With all the side effects associated with amitriptyline, I don't think those odds are very good. I would actually recommend, my own personal opinion, of course, run everything by your doctor. If you look at the drug medication insert, the side effects, amitriptyline should only be used in the severe cases of people with major depressive disorder when nothing else works. Anything else, you should try anything else first before you try this medication. It's also known to cause cardiovascular disease and QT arrhythmia, QT prolongation. And it's also cautioned for use for people with bipolar disorder because it could worsen mania, which may trigger suicidal tendencies. People with seizure disorders, it's known to trigger seizures. And people with angle closure glaucoma, it's also may worsen that condition. So why don't I recommend the use of Elavil reflux disorders? Well, if you've been listening to me speaking for the past 8 minutes, it has a lot of side effects. A lot of side effects, which is the main reason why. But though amitriptyline or Elavil, it is used to reduce pain and visceral hypersensitivity during people with reflux disorders, there are many anecdotal reports of people who get off of it or try to reduce their dosage and their pain comes back 10 to 100-fold. This never really tackles the main cause of their reflux. You know, their weakened sphincters, which Elavil or amitriptyline, actually weakens the sphincters and can cause more reflux over time. You just don't feel it because it dulls the pain. It dulls the nerves. It calms the vagus nerve, so you don't feel the pain, but it can still occur. It also reduces stomach acid, which can increase dysbiosis. It slows gastric emptying, which can cause more bloating and can cause constipation, which causes more abdominal pressure. It's just, in my cases, everything about amitriptyline is that it should make reflux disorders worse over time. People usually on it have to keep increasing their dosage to reduce the pain. Pretty much that's all what the tricyclic antidepressant does, is it just decreases the feeling of reflux, the pain associated with reflux, the visceral hypersensitivity associated with reflux. So you just don't feel it. You just don't feel it occurring, so you don't think it's occurring. But amitriptyline, for most people, and all shapes and forms, it doesn't reduce upper gut dysbiosis of having more opportunistic bacteria than probiotic bacteria like H. pylori, which is one of the main causes of reflux. It doesn't treat any of the root causes like a hiatal hernia, dysbiosis, like I mentioned earlier, having a high stomach pH, which is mainly caused by having dysbiotic flora in the stomach. It doesn't tackle any of the root causes of reflux. All it does is just dull the pain so you don't feel it. And then on top of that, it can even make the reflux worse by, being a smooth muscle relaxer and inhibiting the sphincters so they don't even close properly, to reducing motility, reducing gastric emptying, which can lead to more fermentation in the stomach, which can increase gas, which can displace the stomach upward if you have a hiatal hernia and cause more reflux, or cause constipation, which can do the same thing. The reduction of stomach acid production associated with amitriptyline as an H2 antagonist can increase dysbiosis, because stomach acid is made for a reason, people, other than to digest food. It's also produced to reduce opportunistic bacteria like H. pylori, which can survive in a stomach that produces less stomach acid because the pH is higher, where if you produce normal amounts of stomach acid, it cannot survive. So, there's many things. To improve vagal tone, I linked a self-hacked article on my blog. There are many ways you can improve vagal tone without having to take amitriptyline. There's many ways that you can reduce reflux or even pain by taking anti-inflammatories like curcumin, CBD oil, getting sunlight, which increases natural opioid production, taking magnesium. There's many things that you can do. Omega-3 fatty acids, increasing ingestion of fish oil or ingesting seafood. There's many things that you can do to do everything that amitriptyline does naturally without having to take a medication with a list of side effects this long, and can actually cause the risk of suicide, increase the risk of suicide in people who are even previously not suicidal to begin with. So I do not recommend the use of amitriptyline. I do not recommend the use of Elavil. I know Jamie Koufman, who I think does excellent research, Dr. Jamie Koufman at the Voice Institute of New York, does excellent research when it comes to silent reflux, but her treatment protocol for it, I think it's horrific. The use of amitriptyline long term is horrific. There have been many anecdotal reports even that have came out of her office of people using it for 10 years and then trying to get off of it. And again, like I said, reflux, visceral hypersensitivity, the pain is 100 times worse than it was previously beforehand. So yes, I hope you enjoyed this video and you found it informative. I do not recommend the use of amitriptyline or Elavil for any type of digestive disorder. If you like this video, please like, share, and subscribe to our YouTube channel, and I hope you have a great day.